You can start.
Hello, am I talking to Mrs. Rose Dewitt, 35 years?
Yes.
Okay. Is it okay if I address you as Rose?
Sure.
Rose, actually, the nurse has asked me to see you, and I know that you've undergone surgery in the morning, but I can see that you have excessive pain and repeated vomiting.
Excuse me. Who are you?
Sorry, I'm Dr. Shruti, one of the doctors in the post-operative ward. I'm here to address your concerns.
Yeah.
Yeah, the nurse has asked me to see you because you're complaining of excessive pain and repeated vomiting. Would you like me to give you some painkillers and some anti-sickness medications before I continue?
You gave me something, but they don't help much.
I understand. Just to confirm, any allergies?
No.
Okay. Are you comfortable? Should I continue?
Not so much.
Would you like me to wait?
What are you waiting for?
So that you can talk to me?
Doctor, I'm not able to breathe.
I understand, Rose. I will be giving you some fluids and some painkillers. I will also put you in a position where you're comfortable. I'll start oxygen for you. Okay.
Okay.
Rose, I'll just be quick. I know you're in a lot of pain. I just want to know more about you. Can you tell me how are you feeling right now in your own words?
This pain started some hour ago, and previously it was a little bit. Now it's constant. It's constant in my tummy, and I started feeling dizzy. Now I have difficulty breathing. This proper position helps a little bit. Yeah.
Okay, and I'm really sorry that you're going through this. So the painkillers haven't worked for you?
Not much, like I said before.
And may I know, have you started mobilizing? Have you passed urine?
Yeah, I passed once.
All right, and did you mobilize?
Not much. It's since morning. I still have the pain. Cannot.
Okay, and can you tell me what events led to the surgery?
Okay, I had pain on and off for some time, and I did a scan. GP arranged for it, and they told me there is some cyst, and I got it operated today.
Okay, and what were you told about the surgery?
That they are going to remove my cyst, and following that, the surgery went well. They had some issues with the bleeding, and they had it under control. That's what had been told to me.
All right, and can you tell me if you have any medical problems in the past you've seen a GP for?
No.
Any history of clots or bleeding disorders in your family or you?
No.
Any surgeries in the past in your tummy or down below?
Just this one.
Okay, and may I know if, do you have any support? Do you have someone with you here?
Yeah, my husband should be somewhere outside.
Okay, is it okay if I call him inside?
That's all right. What's happening to me, doctor?
Yes, so Rose, actually, the nurse has shown me your reports. I've gone through your charts. I've also gone through your OT notes. And so what we can see that in your operative notes, the dermoid cyst was removed. There was bleeding after the cyst was removed, and that's why it was managed by giving 2 stitches. And also a drain was placed. I would like to see the drain output. From your charts, I can see that your blood pressure is falling and your pulse is very high, and sometimes, after the cyst removal, there can be, even after we suture the base and we suture it properly, sometimes bleeding can happen after the surgery. And looking at your charts, we may think that there is some bleeding inside. I'm really sorry to inform you this.
What does it mean?
Okay, so in medical terms, what we call it as a post-operative bleeding, which can happen inside, and this is an immediate situation. We need to take urgent actions, and the management is that we will be taking you to the theaters for a repeat surgery.
What? I need another surgery. Oh my God! What is happening?
Rose, I understand this may have come as a shock, and I understand that this will upset you. But I would like to tell you that if looking at your charts, we can see that if the bleeding continues, the BP will fall further, and you may even collapse. And seeing that your life is a priority, we need to take urgent steps. Are you getting me?
Do whatever is necessary.
Okay, Rose, thank you so much for your cooperation. Right now, we'll be shifting you to the HDU. I'll inform my consultant, I'll inform the OT team and the theater. I'll inform my midwife and ask her to open 2 wide IV lines, okay? And she can take investigations again. We'll repeat your blood counts, your coagulation. We'll see how they are doing, how your liver and your kidneys are functioning. And we'll do a immediate bedside scan just to see how much bleeding is there and to rule out any other injuries also. And We will take you inside, and usually I know this has been done as a keyhole surgery. We will try it as a keyhole, but if you're unstable and if bleeding cannot be located and the repair cannot be done by a keyhole, we may have to do an open surgery as well. Are you getting me, Rose? Okay. Also, I would like to tell you that I know that you do not have children and you are expecting future fertility, but sometimes it so happens that if the bleeding is not controlled, we may have to remove the left side ovary as well. Okay.
Then how will I have children? I'm planning to have children.
Yes, Rose, I've gone through your notes and I understand your concerns. However, I'd like you to know that we have 2 ovaries, and even though one ovary is removed, the other ovary will have its function and your fertility will be maintained. All right. Just to confirm, just to confirm, may I know your blood group?
It's O positive.
Any reservations for transfusion?
Yeah, I am a Jehovah.
Okay, and have you provided an advance directive?
Yes, I have.
Okay, and may I know if because you have so much bleeding and you may require blood products. I respect your beliefs, but if at all, sometimes we consider blood transfusions to be a life-saving treatment. Anytime at all, would you accept blood transfusion if at all?
No, I'm strong in my faith. That's why I have the advance directive, doctor.
All right, I respect that, Rose. Do you have any other blood products that you may accept, like platelets, plasma, any other blood products?
No.
All right, and we do have something known as the intraoperative cell salvage, which means that we can use your own blood. In case you have extra loss of blood, we can filter it through a machine and transfuse it back to you. How does that sound?
Yeah, okay. All right.
All right. Also, we'll be informing the radiologist, and there's something known as interventional radiology. If you're losing too much of blood, we can, block the arteries so that it will help you. We'll also use medications to decrease blood loss. All right.
Okay.
Okay, Rose, again, I'm very sorry. I'll document all the discussion. I'll document you being Jehovah's and that I'll put a ban on you. We will talk to your partner. And once all of this is done, I'm really sorry this has happened. I've been raised an incident report.
But why is this happening? Why this happened?
Rose, usually all the surgeons who have done this, they are competent and they are well trained for this. However, this is an unknown complication. It can happen, and it may happen. All right.
Okay, I just have to accept it. All right.
Yeah, I'm so sorry again. I would raise an incident report and we'll be open and transparent once it comes out so it doesn't happen again. And right now I will shift you to the HDU, arrange the investigations, inform the team, and we'll shift you as soon as possible. Is that all right?
Okay, whatever is necessary.
Sorry again, Rose, and thank you for your cooperation.
Thank you.
You have 15 seconds left. Is there anything you want to tell?
And also your post-recovery, it may be delayed and we may have to observe you longer. Your discharge will be planned accordingly. And
Dr.
also BT
Shruti.
prophylaxis. BT prophylaxis.
All right. So how was it, Dr. Shruti?
It's been so long. I haven't practiced and I haven't, my communication is all, it's very terrifying with you, ma'am.
No, not at all, dear. I'll take the compliment.
When you are the role player.
I'll take that as a compliment. But you did quite well. You managed to tick many of the points, many of the information that you needed to give. And at the end, again, when prompted, you mentioned that you will need a further stay duration also, increased number of days also. Apart from that, where exactly you had the difficulty? You told communication you had not been much in touch. Otherwise, what else was difficult
even the
for
history,
you?
I think even the history, because the patient was like, what happened? So I did not complete the history. I could not go back. So I missed quite a points in that.
This can happen. This can happen. Only that you need to have in mind what exactly you wanted to ask. Like, for example, especially the Jehovah's Witness points, the blood group, BMI, those points, definitely you will have to go back and ask. So right away, if you are asked some question by the role player at that point of time, you mention that, and I'm sorry, I have some more information to plan the best management for you. These are all the questions you can ask. This way you can mention and just jut in and ask. Okay, but then don't interrupt the role player, but don't miss out on these questions also. That doesn't mean you have to go and ask every single detail in the information gathering like any other station, which you won't do. Just that you need to ask the relevant detail like this. Okay. Yeah. Where else you had the difficulty? One was information gathering part. You rightly addressed that. Anything else?
I think why it happened to me, I did not know why it happened.
Yeah. We cannot say for sure what exactly has happened and why this has happened, which is why we will initiate an incident report. You mentioned that in incident report, but when a role player is asking you a question, you need not have an answer at that point. If you're honest, you have to mention that I do not know at this point what is happening, but this is an emergency. But we will be looking into it. We will see whatever has happened. And depending upon the results and the investigations, whatever is needed will be done for you. And this investigation will make sure that whatever happened will not be repeated again. We will be open and honest in the investigation. So this can be mentioned for that why. For any information, any disease or anything at all, you always remember what it is, why this has happened, what we are going to do. So this, the three things you can put it up in a flow chart in your mind so that whenever you're going into the discussion, you do not forget this point.
Okay.
What else?
And also, when I told her that I'd gone through the OT notes, I didn't ask her for permission to go through the OT notes, I think.
Anyway, it's
That
given
was-
to you.
was
The
given to me.
information has been given to you. That is fine. But then a lot of information here, like how it was given, will not be given. You will be given a lot of papers, which will be attached in your outside the cubicle, including a very detailed news chart, which you have to decipher. Not like here how it was mentioned, just to show you. But you will have to pick up from there, from the outside of the cubicle. So that is fine. That is all right. Okay.
And also,
So that
I
was-
asked her what led to her, why she did the surgery. Should have I asked it in an emergency situation? I don't know.
See, three things you need to ask. What is happening now? What was told in the surgery? Quickly, you can mention why this was done. Are you aware that why this was done? Of course, she'll be aware. But any further detail, like it would have been an emergency. Here it is mentioned specifically that it's an elective laparoscopic, this one. But otherwise, you could have asked. But then it's not wrong to ask that. Briefly, only that you should not be in great detail, like how you start from the A and C and then go into the current detail. Not so. So that was fine. How you asked was fine. What led to this? That was fine. Not wrong.
Initially, I forgot to introduce myself. That was the
Yeah,
thing.
that is a very common mistake because I'll be the role player will be acting up. They'll either be vomiting or doing something. So whatever you are, which ward you are, that you need to take it up and immediately introduce yourself. And you rightly confirm the name and age by yourself. You did not ask me. You did not do that mistake. But then you forgot to introduce yourself. But it is one of the most important communication aspects. Who am I talking to? The patient should know, right? Why you are here. This also you mentioned, the purpose of the visit. So confirm the patient's name and age and who you are and what is the purpose of your visit. This has to be the opening. So that and all you rightly mentioned. You are called to see why she had been, what has been happening and why you are called. That purpose you mentioned. And you gave me an opportunity also to voice out what is happening right now. So I told her that I had a constant dull pain and then I had been throwing up. You offered this medication. But when a patient has query BP is falling down, the first thing you do is, because I'm breathless also, you give an oxygen along with, the medications. Make sure you address this also. You seem to be having trouble. Let me do these things for you. Just to connect this oxygen, high flow oxygen, and then start an IV fluid. Make me sit up in a proper position and ask me whether I'm comfortable. Because you know these things from the chart that BP is falling. Right. So apart from the painkillers and the antiemetics, this also needs to be done because you need to put up some volume, right? So for the sake of the station to go on, I need to answer some questions. Not entirely, we will be acting out the whole scenario. So the further questions that is acceptable for the assessment purpose. So those things you asked rightly, what happened, why this was done, and where anything at all was mentioned to you. So those things were all right. So this was all the information gathering part. Later on, when you talked about blood transfusion, you asked whether I'm a Jehovah's Witness. So for the Jehovah's Witness, there are certain points which you rightly addressed. You mentioned whether the advance directive is in place and whether I accept any other products. And you mentioned about the cell salvage also, which was accepted by the role player. So that is fine. This you need to mention to the consultant. This you need to mention to the anesthetist also. This you can put in one word. I'll be informing your status with the consultant and the anesthetist because this is a high risk. A patient who is a Jehovah's, who is bleeding, is a high risk. So you mentioned it, but then explicitly mentioned that since you are a Jehovah's, I'll put in a word that you are a Jehovah's. You mentioned that band also, which says that indirectly. So that was fine. And document your discussion, document that I'm a Jehovah. So that documentation also explicitly mentioned. And one more thing you can do is check my vitals right now. What is the vitals right now also? Continuously, you will be starting to monitor immediately. That also will be part of information gathering. So communication wise, you had clarity, but when you were explaining, it was a little bit prolonged, isn't it? you could not come to what exactly is happening at that point, right?
Mm-hmm.
A little bit it was prolonged, so do not prolong that anxiety. I can see this is an emergency. You seem to be possibly, most probably, you seem to be losing blood, which is an emergency. I'll be calling my consultant. I'll be informing the anesthetist, the blood bank, and the consultant anesthetist as soon as possible. Urgently, I'll be mobilizing team. We will be there to take care of you. And what are all the steps which is to be done? You can chunk it up and mention. And the chunking also you did nicely. You chunked the information and also you checked my understanding, so that was fine. Your empathy was also good. Do not keep saying sorry more than necessary. Sometimes people will miss that. Mentioning that this is an emergency. This needs to be told to the role player. This is an urgency. We need to act on an urgent basis. We'll be doing a lot of things simultaneously. Don't be scared. We are there to take care. So that needs to be mentioned. You mentioned it rightly. So the next steps, like taking some bloods for investigation, including the scans, and we will want to see what exactly is happening. Most probably it is a bleeding which has happened. We do not know the source, which is why you might need a further surgery. I'm sorry to say. It could be by keyhole, or you might need a larger cut through the tummy because the BP seems to be falling. Laparoscopy, keyhole might not be feasible at that moment. So that you need to, you mentioned it, that that needed some clarity. And incident reporting also you mentioned, so that will be under safety. So communication, that's all. Jargons were not there. Some things like IV, you mentioned IV coagulation. So those things were the only jargons. That is fine. And one more thing in safety is whether you are put on any blood thinners at that point. That will be under the examiner feedback, but just that it came to my mind, I'm telling you. If she had been on any blood thinners, you have to mention explicitly that you will stop the blood thinners. Okay. And yes, rightly, like how you mentioned, we will try to control the bleeding, but if it's not possible, we might want to remove the ovary also. But I do know that you had been planning for fertility. Rest assured that there are 2 ovaries. We'll take every possible opportunity to save the ovary. But in case it is not possible, since a lot of bleeding might continue. In order to save your life, we might want to remove the ovary. So best intention, this you can mention it this way, right? Okay. So the safety aspects would be avoiding transfusion. You elicited the Jehovah's points. You escalated immediately. You mentioned the urgency, and you had nice clarity, not little bit, nice clarity you had. And when I asked why this happened, you do not go and start defending your colleagues. Okay, we do not know exactly what has happened, but we will look into it would be a good answer. I did not blame any colleague at all. Why this happened was my honest question. So don't bring the colleagues unless, unless asked. So that non-blaming nature was also there even without my question, but do not be defending too much. So, and another thing in Jehovah's is, if we do not transfuse blood, it might mean that it could be life-threatening as well, which is why blood transfusion may be necessary, but we do respect your wishes. That was very well done. A little bit earlier also you could say, when I told that I am a Jehovah, you can just say that yes, we do respect you, respect your wishes, and then go into further questions. You again asked, how you asked was, I told you that I was a Jehovah. And then you asked whether I do accept any transfusions, and then I told no. Later you told it means that it might be life-threatening, but we do respect your wishes. It came a little bit late, I felt, but it's not completely wrong. Just that you could bring it up a little earlier is what I felt. Okay, it's not wrong, but that's it. And yeah,
that she can change the consent anytime.
exactly. There is a beautiful chart which I prepared when I was preparing. I'll put it up in the group. What are all the Jehovah's points? Exactly. And once you mentioned in between that we have 2 ovaries. Please don't include yourselves there. We have 2 ovaries. There are 2 ovaries would be fine. Don't include yourselves also there. So that's all from my side. Yeah, that's it. Very well done. Thank you. Over to Sumi.
Yeah. Yes, Dr. Shruti, I also go with Dr. Meera. You have mentioned most of the points, just some amount of clarity with communication and applied clinical knowledge. You need to add a few more points. Otherwise, it was a very well done presentation. It was well structured, and you had addressed her concerns related to the pain, her fertility, and about the Jehovah's. Everything you did mention it very well. So now, starting at the beginning, you did have the situational awareness. You did not ask her her name and age. You confirmed it by mentioning it. Just that you forgot to introduce yourself. So any kind of station, make it a point that you start with your introducing yourself and then asking her identity. You can tell like, I'm Dr. Shruti, the the registrar here, and am I speaking to so and so? So in that way, you will not forget in this kind of emergency situations. And then you went on to address her pain, and then you made sure that she does not have any allergies, and then you gave her the pain medications. And after that, again, you confirmed that she is comfortable. So all this was fine. And you also mentioned you will be quick in the history. These are all important points that you need to mention. And then going on to the history, it's already mentioned she has pain and vomiting. It's better you can ask a few more questions, such as whether she's having any dizziness, any bleeding from down below, or you asked about the urine output as well. You can also ask about the bowel symptoms. So just a few more questions related to her present condition. And then, yeah, you missed taking her permission to access her notes, but that's fine. Overall, it was a well done information gathering. And you did, during the history, you did mention, you forgot to ask about BMI, blood group, and reservations. You could have asked her about the examination that you will do check her vitals again. And then when you're going on to explanation, you can also add like there is some amount of concerning news, and then you can start explaining about the her condition. So in that way, you're just preparing the patient for that. Okay. So that was one communication point that was that could have been taken into consideration. And then you were telling about only internal bleeding. See, you can tell it is most likely internal bleeding. However, there are certain other conditions also, such as any injury to the bladder or the bowel, or so these are the most likely ones, or any infection which we need to rule out as well. So you will be telling about the further management. So always make sure you tell some differentials, at least one or two. You should tell the most likely one and then tell at least one or two investigations. And then you did rightly mention this is an emergency and this needs to be managed immediately. And so when you went on into the investigations, you told about the bloods. You can also add about doing a scan to confirm what the condition is about. And then we'll be checking, we'll be monitoring you. All this was very well done about the possible return to theater and the route of surgery. All this, you mentioned it very well. So that was just one thing that I thought you could mention. And in the management, you please add on about the IV fluids also. It was told in the beginning in the information gathering, but you need to tell this again during the management as well. So then you mentioned her fertility options and blood grouping. Jehovah's was very beautifully explained by Meera. And then incident reporting, documentation about the partner, this was all well done. And you could then once this is done, you were telling about the post-operative care. And also it is important to mention about the thromboprophylaxis risk. If needed, we'll be giving you blood thinning injections also, and about the stockings and importance of mobilization following the surgery, about the antibiotics. And yeah, and then about addressing why this was done. This was very beautifully done by Meera. So now let's go on to the key. Ask her consent to access her notes. And then you'll go on to explaining about what the condition is. Before that, the examination part. And so explaining about it, the most likely differential, and at least one or two other differentials needs to be mentioned. And always make sure you give her a short BBN that there is some concerning news. That's it. And you had already offered her the support, so that's fine. And next, you'll be talking about the immediate management. That is make sure she's stable. So you'll be giving the IV access, then fluids and bloods that will be sent, and analgesics, antiemetics also needs to be mentioned, and about the monitoring her vitals and monitoring the drain and urine output. And once she's stable, we'll be going in for the imaging, that is a scan if needed, and nil by mouth has to be mentioned. Then you need to explain to her about the next. It's important to control the bleeding, find out where it is bleeding from. Most probably it will be, we will have to open up. And also we will try our best to conserve the ovaries. If not, we may even have to remove the ovaries. I'm sorry to say that, but this is important to Jehovah's Witness. This was very well done. You need to offer her the other blood products, and then give her the cell salvage and documentation informing the team. And always make sure you tell her that she can change the consent anytime. Even before the surgery also she can be done. And make sure you tell her that you respect her wishes. And documentation, incident reporting, duty of candor, that is being honest about what had happened. And then safety netting. So you will summarize what will be done. That is, she'll be shifted to the HDU, give her the stabilizing management, then going on for the definitive management, and then about her post-operative care, antibiotics, thromboprophylaxis, and monitoring her vitals and extended stay. And once she's good, she can go home. And also, we can also fertility was addressed, that is enough. So, and then ask her if she's having any questions. So when we come to the domain-wise assessment points, information gathering. So it's the ruling out other complications and other risk associated risk factors. Then communication with the patient, empathy, listening to the patient, giving the information in chunks, check her understanding, avoid the jargon, and always involve the patient. That is a shared decision making. Never give false promises. That is, she will get better. This is fine. Never tell her whatever is the next line of management and what is the present situation, and then give her a reassurance that she has the good team to take care of her. And then applied knowledge, it is about the evidence-based management. Okay, managing the shock, and then the definitive management. And then coming to the patient safety approach, make sure she is stable now, and then early escalation, involving the colleagues, that is the MDT. Then the same thing, it's again all the same thing that's getting repeated. And Jehovah's Witness comes under the patient safety aspect, and communication with colleagues. So this is the team, anesthetist, theater team, nursing staff, and documentation, and a clear management plan. So that is about this task. Anyone would like to add anything? Any doubts?